Jeez, Nick, which hole does that thing go into?
But which hole does this go into?
Yeah, look at it.
This is an interesting apparatus for sure. So Nigel, as you know, I like to do work in both human medical device and animal medical device.
Yes.
And this is from the animal side of the spectrum.
I'm relieved, I guess.
So this is a device that's used to go into the backside of typically equines, horses, and it's for doing some sampling. This has a nice soft tip, and it goes in, and this usually has a swab on it, but I've taken the tip off for something else. And you can stick it in like a a little proboscis, take the sample out, and this, of course, is for some reproductive strategies.
In utero, etc.
Exactly. So you need a nice
well, it's quite the
device to do that.
And so, are you using it for that now?
I am not. What I did is I'm actually, as you know, I'm a microbiologist, and I was doing a study. Actually, this is several years ago now, but I wanted to share the story.
It's a good story, I'm sure.
Looking at different types of bovine respiratory diseases, and as you can imagine, a cow has a big long nose, right?
Yes.
And there's, if you've ever seen a cow nose, it's kind of mucusy and lots of stuff at the end, which is interesting. But I'm really interested in kind of way deep back inside, looking for a particular organism called Mycoplasma bovis.
Oh man, you're giving me COVID swab vibes here.
100%. Well, and the crazy thing, Nigel, is I was doing the study right around COVID, so actually getting these was really tricky. And so I had to look for different sources of these things. And of course, we adapted something that was used for, like you say, a different hole, and use it another way, and we were able to go in, get that deep swab, and be able to assess this organism.
And what did the cow say?
I think moo or something. I don't know. Anyway,
was the cow okay with it?
They were. Yes, they consented.
Great. Okay, great.
But anyway, the reason why I'm talking about this is, as engineers, right? We're always trying to design the perfect instrument for the right job,
specific job.
And here's a case where, hey, look, something existed. It was sterile. It was well proven. It was in a safe environment, and we needed something, fairly quickly to do a different bit of research, and it existed right off the shelf.
I mean, there's so much value in just saying, I can order that SKU. I know how much it costs. Maybe it's even already in my warehouse. I just have to run another one. There's tons of value. I even myself, have worked on projects where, we see people using things kind of off-label, but in a way that kind of makes sense, like operating table using like a leg rest as an armrest as a leg rest because of extra tall, extra wide people. And it's the clinician's choice usually at the end of the day, but we do have to be prepared to some extent to kind of foresee those uses and either bring them in and make it happen, or at least make sure it's not going to go horribly wrong if it does happen.
Yeah, or using something to go in the opposite hole.
Yes, well, all good use cases, I'm sure.
Very good.
Well, thanks, Nick.